talking to, but Dr. Lisa Miller is our finalist for the Associate Dean for Public Health Practice position, which, and I believe all of you have seen her CV attached, but she's got extensive experience leading public health programs, and is very engaged in research in our community across multiple disciplines, but some of the highlights being birth defect surveillance, autism surveillance and research, muscular dystrophy surveillance and research, occupational health surveillance, environmental health surveillance, and infectious disease surveillance and research. So an extensive CV and a lot of expertise across the areas that our students are engaged in. And we'll have a lot of say in things like practice-based learning, community partnerships. And so we want student feedback and to really host an open conversation with Dr. Miller about her goals and vision for this position in the school. So if we'd like to introduce folks and just see kind of who's on this morning. I'm Chloe Benyon. I'm the school's I used to be the program evaluation coordinator. Now I'm academic affairs and student affairs director.
And maybe we'll just maybe I could go around and call on people so we don't have people talking two at a time. Cindy, you want to introduce yourself? You're an important player here.
Sure. I am the business manager for the dean for the School of Public Health, and I provide administrative support for all things for the school. So if you ever have any administrative questions, I'm here. Just please reach out to me. Thank you for attending today.
And thanks for your help, Cindy. Susan, do you want to introduce yourself?
Sure. Hi, I'm Susan Zane, and I'm a PGY2, and I'm a preventative medicine resident, and Dr. Miller is my program director.
And Nancy, I'm just going down the row here. Nancy Katz.
Hi there. I work with Cindy in the dean's office. I'm a senior business professional. I've been with the school for a couple of months now, just moved here just this last weekend. But yeah, I'll be working with Cindy in the dean's office, assisting the associate deans and Cindy.
Great, thanks, Nancy.
Mm-hmm.
And Mona. Hi, Mona.
Hello, yeah, I'm Mona. I'm a fourth year PhD student in the epidemiology department.
Thanks for joining. And Taylor?
Hi, everyone. My name is Taylor Rutledge. So I am very much like Susan. So I'm a medical resident, preventive medicine as well. Also split my time, pursuing my MPH in Epi. So given that, I think I know a lot of the names here and work very closely with Dr. Miller. So glad to be here.
Thanks, Taylor. And Molly introduced herself on the chat. She's not able to, she's just muted. So see the chat for Molly's introduction. And I think June also introduced herself in the chat. So look at the chat for an introduction from June. Thanks for joining us, both of you. And Poppy, are you able to unmute?
Yeah. Hi, everyone. My name is Papi. I'm a second year EP student. Yeah.
Thanks. Yeah, thanks for joining us. And Ginger, are you able to unmute and introduce yourself? Maybe not. Ginger is an epidemiologist at CDPHE who I've worked with in the past. So one of our important partners. So it's great that Ginger could join. And Anu, I think, joined. We're just doing a little introduction because we're a pretty small group here at Anu. So if you want to introduce yourself.
Sure. I'm a first year preventive medicine resident. And pediatrician prior to that. So,
yeah, and working on your MPH.
Yes, sorry, and yes, definitely working on my MPH. Hopefully, to do a global epi as my concentration.
Great. Okay, so I do have a few slides that I want to go through to sort of get us on the same page, but then I hope that we'll have plenty of time for questions or just input, you know, that I'm not necessarily needing a question, but if anybody wants to just give me some input, I'm really happy to hear that as well. And welcome, Brian. Do you want to introduce yourself? We just started out with a little introduction for everybody.
Hi, everyone. I'm Brian Early. I'm a medical epidemiologist at CDPHE and a graduate of our preventive medicine program. And I was using Ginger Stringer's Zoom account because she has the best privileges. But
All right.
it was me the whole time.
All right. Good. I introduced Ginger, so maybe let her know she got introduced on this call, but it was all good. All right. So I'm going to go through these slides and thanks, Cindy, for advancing these for me. And I want to say a bit about my multiple jobs because there was some reference to my multiple jobs when we all introduced ourselves. So I do have multiple jobs and they're all really part-time. So I am the program director for the Preventive Medicine Residency, which is a training program for physicians during which they get an MPH if they don't already have one. And, you know, that's about a 0.3 FTE job. This interim dean for public health practice in the permanent position is a 0.2 FTE job. And then I do a little bit of teaching, and I also do a little bit of work with the School of Medicine working on their new curriculum for health and society. So I kind of piece together multiple part-time jobs just so you don't think I'm, you know, working 80 hours a week or something. I'm not. So just to clarify that. All right, Cindy, I don't see slides.
Unmute myself. I'm going to try it again. I'm having some issues with my slide share for some reason.
Okay, and I could try it too if that doesn't seem to be working for you. It was working, and then it like went to.
It went away. Okay, let me give it another whirl here.
Technology.
I know. I usually don't have issues with my slide share, but.
I know, I don't either. And then of course.
Do you see this?
I just see the captions.
Okay. Interesting.
The captions are great and appreciated.
Let me get it off there.
When I did the presentation for the faculty, my computer froze. My computer's never frozen on Zoom, ever. But of course, when I did this for faculty, it froze up completely.
There's been a lot of bad tech luck this week.
Bad juju. There we go. That looks good.
Can you?
We're seeing presenter view, which is fine, but if you had notes, yeah.
Wow. Perfect.
Great.
Okay. I think that looks good. All right. So Cindy, you could go ahead and go to the next slide here. I want to start out big picture with the vision. And this is actually the vision for the School of Public Health, that it will become one of the nation's premier institutions for public health education, research, and practice, bold by me, by delivering programs that are based in science, proven in practice, and adapted through creativity to meet pressing population health needs. So I think for my position as well, this is the vision, except for me, I think about really making real this elevation of practice to the same level as education and research. So really focusing on a premier institution in the area of practice. Next slide. And I think that's important that we at least start with a working definition of public health practice. One of the things that I've observed as we've started working in this area is that we don't necessarily all know what that definition is or agree. That's something that's still in progress, is agreeing on that definition, but I want to start out with just a working definition of what I think is a good start, which is defining it as the strategic, organized, and interdisciplinary application of knowledge, skills, and competencies necessary to perform essential public health services and other activities to improve population health by our students, staff, and faculty. So when we're thinking about academic public health practice, it's what we do as students, staff, and faculty, really applying our skills and knowledge. So that's the basic, very broad definition of public health practice as I think about it. Next slide. And some of you may be asking, what is this position? So I thought it might be helpful to talk about that early on as well and really define what the position is meant to be and how it relates to other parts of the school. So the Associate Dean for Public Health Practice is really intended as a position that gives leadership, guidance, and technical assistance in the area of public health practice. And it's a liaison or a connector between the school and community members and community organizations. And that connection is something I've kind of done my whole career and I really love to do. Importantly, I think this position is part of the leadership team. So that's part of this elevating it to the level of education and research in the school. So this Associate Dean position is part of that leadership team along with the other Associate Deans of Faculty Affairs, Student and Academic Affairs, Administration, and Equity, Diversity, and Inclusion. So all those Associate Deans, the chairs of departments and centers, and the Dean are really part of that leadership team for the school. And then as well, there's lots of other public health practice activities that go on in the school, of course. So there's the practice-based learning director that really oversees the practicum. There's the capstone director that oversees the capstone. There's our career and employer relations office that provides services and resources for students and employers. So all these folks are also making connections with partners and community members. But this position is kind of an umbrella position over all of that activity, kind of coordinating that activity. As well, we have a new public health practice committee, which is again a way to sort of coordinate all these activities. And I'm going to talk more in a couple slides about the committee itself. Next slide. So I do think it's important to do a little bit of history because this position has been around for a while. It's looked a little different. So you could go on to the next slide here and I'll talk about the first person in this position was Tim Byers. And he was the first Associate Dean for Public Health Practice starting in 2008. He was also the director of the Center for Public Health Practice. And he's since retired. But I liked this quote from Tim that was in a blog about Tim. And it said, "It wasn't that I ever discovered any one thing, but I helped move things along and was part of groups that helped make changes that might have taken much longer." And I think that's what a lot of us do in our positions. So I really, I liked that quote. And then next slide, we have the next Associate Dean for Public Health Practice who started that position in 2015, and that was Elaine Morato. And Elaine was in the HSMP department. She was also, importantly, the interim dean of the school from 2016 to October 2017. And she said her goal was to catalyze excellence in practice-engaged education, research, and service, both internally and externally, by building bridges in that connector position with our community and public health partners. So, you know, a good description of the position, I think. Next slide. I see an opportunity here to really advance the position and advance public health practice because we really have three things that are coming together. And those are filling this position, the Associate Dean for Public Health Practice. There are also the strategic plan public health practice elements. So if you remember, our development of the strategic plan started in 2019, and we have a specific section that's just on public health practice objectives. And then we also have an ad hoc public health practice committee that's been approved by the Faculty Senate. So let me talk a little bit more about these two additional areas here in the next slide. So first, the strategic plan. There was a working group that put this plan together. I was part of that working group along with several others, including Molly Patilla, who's on the call. And the leads of that group were Lee Newman and Virginia Visconti. So this group worked with a couple external people as well to really try to craft where we see the school needing to go. And there are several elements in that public health practice strategic plan that are there to follow. So I think it's a good foundation to start with. And next slide. So now we have the Public Health Practice Committee, and that was really part of the strategic plan to create this committee. This committee hasn't existed before. You know, there's been a research committee, there's been a curriculum committee, but there's never been a public health practice committee that kind of brought everything together in one group to help coordinate and move things forward. So now that we have the strategic plan that we want to move forward, we thought it was really important to create this committee that can help advise the Associate Dean for Public Health Practice on how to move this forward. The chair of the committee is Virginia Visconti. So again, some continuity from the Strategic Planning Committee. She was a co-lead of the Strategic Planning Committee. She's now chair of this committee. And you can see in bold, we have other people who were also on the Strategic Planning Committee. So those names in bold were part of the Strategic Planning Committee. So again, we have some continuity there. These are all folks who are involved or very interested in public health practice. And I'm not going to go through and read all the names here, but I hope you can see that we have a wide variety of people. We have a broad representation of the different departments and the different centers in the school. We have representation from CSU and UNC. So we're importantly talking about all three campuses when we talk about public health practice. We have representatives from practice-based learning and capstone integration. So we're really trying to be very broad and inclusive in this group. Next slide. And we do have this broad representation, but I'm hopeful we can grow that even more and get broader representation. As Chloe mentioned, you know, most of my career has been spent in governmental public health. So I feel like I have a strong governmental public health background, but I recognize that governmental public health is not all of public health practice. Public health practice is more broad than that. And so I feel like I really need that input from this broad representation of members of the committee to really think more broadly about public health practice. And yeah, thank you. Just a couple more comments on this slide. I do think the members of the committee are really vital to thinking about how we implement the strategic plan. That's one of the major things this group will be doing, is really advising the Associate Dean for Public Health Practice about exactly how to go about implementing that strategic plan. I think they're also really important folks who can help communicate and promote public health practice to the rest of the school. And so there is a priority part of the public health, or a priority of the strategic plan that's been assigned to the Public Health Practice Committee, and that is to strategically develop partnerships to advance equity and social justice. So that will be the first goal that the committee will work on, but there are other goals as well and objectives as part of these goals. So there's a lot of meat here in the public health practice strategic plan. I think And everyone just make sure that they're muted. It sounds like maybe somebody joined and wasn't able to mute. There's a little, thank you. So the other strategic plan goals are to strengthen the school's identity around practice and service, to expand our network of community partnerships, and to really enhance and support faculty, students, and staff engagement with practice. The next slide. I do want to spend a few minutes just talking about some examples of public health practice, and some of these you may know about, some of them you may not. But to me, it illustrates the depth and the breadth of public health practice that's going on. There's a lot of public health practice that's going on in our school right now. We don't always know about it, and maybe sometimes we don't recognize it as public health practice, but there is a lot of activity. So I want to just give you a flavor for some of that, with some emphasis on some of the student involved activities. So this is one that Molly Butilla was involved in. This was a research project that looked at mask use on campuses. So Molly worked with some students at CSU to observe students on the campus and their mask use. And then they collaborated with 5 other campuses from across the country and pooled their data to describe what mask use looks like on campus. They also fed that information back to campus administration so they could help promote mask use and educate students about how they were doing with their mask use. So it had some real public health application. So it was research, but it was applied public health. And this was a little graphic from the MMWR that was published on this topic. It was good to see that 86% of students wore their masks and 90% of those wore them correctly. So that's good. And if you want to read more about it, there's an MMWR from November that was published that describes the work in more detail. The next slide. And this is something that probably everybody knows about, but I don't want to miss the opportunity to talk about this, that our students have really played a big role during COVID with both case investigation and contact tracing. This particular article from the CSU newsletter talks about Colorado School of Public Health students taking on roles as contact tracers, and specifically on the AMC campus. So part of the specific campus response, and this article mentions Will Rausch, who was a second-year MPH student in global health and health disparities at CSU, who was working on contact tracing. We know that there were other contact tracers at Larimer County Public Health, other local public health departments who were students at the School of Public Health. And in addition, the State Department of Public Health, CDPHE, hired 75 students to do part-time case investigation and contact tracing. So a great contribution to COVID-19, but also great experience for our students. So it was one of those things that we were really able to step up during COVID and do in partnership with our state and local public health departments. And next slide. And then this is another article from our internal newsletter about our volunteer system. So Olivia Zarella was really the brainchild of this early on in the pandemic, and really helped organize students at mostly the AMC campuses to volunteer for various COVID-related activities. So students made masks, students helped with social media posts, and did a variety of things that various organizations needed help with during COVID. And there's this great quote here from Olivia in this article saying that most of my fellow students have a sense of wanting to help our communities. That's why we went into public health. So we recognize that students want these opportunities. They want these practice opportunities. So I think this was an important activity during the pandemic. And next slide. Here's another example from the Center for Health, Work, and Environment. that maybe you don't know about. So they stood up a Facebook group that was called Sustaining Emergency Medical Services, and they were able to serve more than 1,700 emergency medical service providers, where they could ask questions, they could get support from each other, share resources. And they also facilitated a bi-weekly meeting for EMS agencies. So again, something that was very useful during the pandemic and something that maybe people weren't aware of. Next slide. This is another example. This is from Piper. Piper is the Program for Injury Prevention Education and Research. And faculty at Piper partnered with the State Health Department, CDPHE, to lead this CDC-funded network called the National Peer Learning Team on Child Maltreatment. And what they are really trying to do is elevate the priority of child maltreatment prevention among state and local health departments. So again, very public health practice oriented. One of the things they have is this Research in Progress webinar series about preventing adverse childhood experiences, or ACEs, and child maltreatment. So they're not only bringing the latest research and cutting edge information to state and local public health, but they're also, I think very importantly, asking for the input from public health. So what is it that we as researchers should be focusing on? What are the important questions that you need answered? So I think that two-way communication is vital. Next slide. Here's another example that's about health policy in the health policy area. And this is specifically about using health policy expertise and applying that to state legislation. So a great opportunity here to apply our knowledge and expertise to something very practical and real. And some of you may be familiar with a fiscal note. A fiscal note is a note that is attached to legislation that describes the monetary impact of legislation. So a health note is analogous to a fiscal note, but a health note really describes the health impact of legislation. What a great idea, right? And it's really meant to provide very objective, nonpartisan information that can help legislators understand the connections between all those things that we as public health professionals know impact health, but maybe not everybody does. So things like education, housing, employment, how do those impact health? How do bills on those topics actually impact health? And we know that there's often lots of research in that area, but maybe not very accessible by our policymakers. And this particular piece of legislation was about funding for full day kindergarten from 2019. And it really tried to answer the question, what is the evidence base for full day kindergarten and its effects on children's educational outcomes and short and long-term health and well-being? And there's literature that addresses this. So they really tried to pull all that together and provide that in a pretty concise, readable format for legislators. And this was part of the Health Impact Project that was funded with Pew Charitable Trust funding and overseen by one of our faculty in HSMP, Greg Tung. Next slide. And then these are some activities from our Latino Research and Policy Center. And I don't want you to read all these. The point of the slide is that there's a ton. There's too many. That's the point of the slide. There's too many for a slide. So they have been so active with very applied public health measures. I'll just highlight a couple of them that involve students. So there were Latino health corps students that volunteered for an intake event. There were also, I can't see the bottom of the slide, but multiple, sorry. Maybe you can see the bottom of the slide there. I can't see it, but I think there was another highlighted student activity. But you can see just lots and lots of activities by the Latino Center. Doing lots of outreach to Latino groups, doing presentations, developing lists of community resources for Spanish-speaking community members. So really focused on addressing the community needs related to COVID. And next slide. And I wanted to finish this section with a plug for the Practice-Based Learning and Career Exploration Week, which happens next week. This is a great opportunity that's been organized by our Employer Services Office, and they have 18 organizations that will be presenting. So they're going to talk about their organization, the jobs, the practicum opportunities, and answer any questions. So I think this is a great public health practice opportunity to really look at that connection between your school and student work and activities and what that job market looks like and what they may be looking for as far as your skills and competencies in the coming years. So I would urge you to look at that and try to attend some sessions if you can. And then I want to talk about equity in public health practice. Not because it's really a separate issue, but just to say, I think it is part of what we do in everything we do. And so to me, it's not a separate issue, but it's really part of the lens through which we do public health practice. I do think it's important that we have some humility, especially when it comes to equity with our public health partners. I think in many areas, our public health partners are the ones on the ground who are implementing public health. They are experts in that, and I think we need to recognize that. And in some areas of equity, they have things that they can teach us. So I think that humility is an important issue with public health practice. The associate, couple more comments. The Associate Dean for Equity, Diversity, and Inclusion, and the Associate Dean for Public Health Practice. So Cerise Hunt, who's the Associate Dean for Equity, Diversity, and Inclusion, will work closely together. And Cerise and I are already working closely together. We are working on hiring a shared staff member. So we will have a staff member that is 50% public health practice and 50% equity, diversity, and inclusion. So this person will work on initiatives in both areas. And I think, lots of those initiatives will be connected and will cross each other. So I think this is a great opportunity to really work synergistically with Cerise. And the staff person is really important. As I said, this is a 0.2 FTE position as Associate Dean. So having a staff member who can help implement some of these initiatives is very important. So that position has been advertised and we're in the process of working through the hiring. We also have shared objectives between equity, diversity, and inclusion and public health practice in the strategic plan. And our priority objective is really a shared objective, is to really look strategically at our partners and partnerships and say what's missing here. What partners and partnerships do we either need to strengthen or get new partnerships to really make sure we can advance equity and social justice. And our committee will help us to do that. And next slide. And then I thought I'd spend just a minute talking about some new directions or some other ideas that have been percolating. One of those is the idea of an academic public health department. And some of you may be familiar with that. But that's really a formal relationship between a public health department and an academic institution to really strengthen that connection between education and practice. Larimer County Health and Environment has a formal MOU with CSU, so they have this academic health department connection, but I think there are other opportunities that we should explore, and I think there's interest from public health departments in pursuing this, and it can just strengthen our connections. There's also lots of public health practice initiatives, and people contact me basically weekly, talking about things that they are excited about, that they want support to move forward. So I'm interested in, working on those and seeing how we can really develop some of those interests that are in the various centers and departments. HSMP is interested in trying to develop some sort of policy fellowship where you could really do more of that legislative work that I talked about, like the health notes, and really give students very hands-on experience with the legislative and advocacy process. The epidemiology department is interested in figuring out how we can expand our student experiences at the state health department. How can we give them some of the support they need, at the same time giving EPI students more of that experience that they want. And then there's also a group called the Colorado Public Health Workforce Collaborative that I think is very connected to our vision and mission. They are trying to ensure an effective and efficient public health workforce, look at the gaps, the innovations, and how we sustain a highly skilled workforce. So some of those same things that we're interested in. And there are several of us from the school that are part of that collaborative, but I think that's an important group to help support and work with. And then I think we need to acknowledge that the post-COVID world will see changes. We know that there will be changes. We don't know, I think, yet what those look like, but I think we need to be able to react to those and adjust. So we do need some flexibility because I am sure that things will change. And next slide. And it's interesting to go back and look at literature that was written before COVID and see how their predictions hold. And this one I think is really telling. This is the article that, again, many of you may be familiar with about public health 3.0. So how does public health look in the next iteration? And this was actually written in 2017. And there's a quote in this article that says, I just need to move my picture here. Unfortunately, the need to strengthen the public health system and the peril for failing to do so is often only revealed in the context of disasters and crises. I think very telling, and I think that's part of what we saw during COVID, right? We saw some of the areas that we need to strengthen. But this article in 2017 was really focused on talking about partnerships, which is what this position is all about. That Public Health 3.0 is about cross-sector collaboration. We know that we need to work with all different sectors that impact health to really be effective in the big picture. A focus on social determinants of health, which I think we've moved forward quite a bit in how we've thought about that. And then they talk about this role of a chief health strategist who really needs maybe some different sorts of skills to drive collective action. So how do you work with these groups? How do you work for system change across different sectors that may involve some different skills than we currently have? Thanks, Cindy. And I think this is my second to last slide here. In the next slide, I wanted to also point out this second article called Reimagining Public Health in the Aftermath of a Pandemic. Also talks about how things may look different going forward. And Dean Samet was one of the authors of this more recent article from November of 2020. So a reinvented public health system will depend highly on leadership and political will, rethinking how we categorize and address population level risk, employ 21st century data sciences, and apply new communication skills. So some thoughts about directions we need to head. Okay, next slide. And I think that is it. So a little mask lesson here, and then open to questions and also just comments or input. It doesn't have to be a question if you just want to, I'm eager to hear your thoughts about public health practice. So especially since we have a pretty small group, let's just have a conversation.
Thank you so much, Dr. Miller. And folks, if you want to put, I'd love it if folks want to speak out loud, or those of you who can't unmute, if you'd like to put questions in the chat, I'm happy to read those out. I have to leave at the hour, but I'm really excited for this discussion.
Thanks, Chloe.
I'd like to just kind of ask a general question, you know, like what we said in the last few slides. Something that's been going through my mind is we have now an initiative, or because of the pandemic, we have a rare opportunity where we've exposed or shown some of the big deficits in our public health, you know, infrastructure. And how can we in this field capitalize on that and make sure that the momentum from that carries forward? And are there certain areas that we want to focus on so that we can use that to, you know, to increase our equity and all the issues that we've seen? Are there a few areas that we focus, and how do we go about doing that?
Yeah, I hope in a way that's rhetorical. I think those are the big questions, right? And I think everyone is grappling with those, from HHS, from, you know, the president, the HHS, to CDC, to the state health department, to every local health department. So I think it's a system-wide sort of major discussion. And I do think, you know, good or bad, a lot of public health is driven by funding. At least again, in my world of governmental public health. So I think, you know, there's probably ways to influence that funding, but I think a lot of it will come through, where's the funding? Where are the grants? And I think they will be in those major areas. I think everybody recognizes that equity, data, surveillance, communication, you know, there are some big areas, I think, that are going to get more attention, but it's a big conversation. And I will just say, you know, I lived through the bioterrorism era, which was much different. It was a much smaller scale, but we did see this huge governmental response after 9/11, and after the minimal anthrax scare that we had, which at the time was huge. But we saw some major changes, and we saw some major investments. And so I think we'll see something even bigger. But there were major investments after that, and I, you know, I would think that we're going to see something. Not quite sure what that will look like.
Hey, Dr. Miller, you know, when you talk about the additional investments, I feel like with the sort of bioterrorism concerns, a lot of those investments were very closely tied to addressing that threat in particular, and didn't necessarily prepare us well for a pandemic. Do you think that there's a concern that these investments could be narrow and wouldn't help us to, you know, deal with, you know, say a further worsening of the opioid crisis or other public health threats that, you know, I'm sure our state and nation will face it soon? And is there a way that public health practice can help make sure that health departments maintain the flexibility to respond to all important threats?
Yeah, good question, Brian. I think that's a lesson learned with bioterrorism. I think that lesson was learned, and very quickly, at least there was some attempt to widen the focus and really look at, you know, all hazards and not bioterrorism. And to strengthen, you know, core infrastructure. You know, it's hard sometimes to imagine what you're going to need and what the next thing is, but you're right. I think we really do need to focus on infrastructure. And I don't know that you can help, but, you know, there will be some pieces, I think, that will be maybe specifically responsive to what happened and may not end up helping us with the next emergency, but I think that is a lesson learned. And I think there were a few things that happened in bioterrorism that were very useful. You know, we did keep up emergency preparedness, and even though we think it wasn't, you know, we would like to have more capacity. Imagine if we didn't have the capacity we had. So there were some things I think that were helpful. Health Alert Network was started during biotourism. That's something we still really depend on. There were some aspects, and I think some partnerships probably that were developed that have been helpful. You know, it's hard to say what it would have looked like had we not had some of those things that were developed, but I think it's an important point.
I think, Dr. Miller, that's what I was kind of wondering was like, you know, we have this impetus whenever there are these major crises. And what are those, you know, how can, and at that time, money flows a lot more into our field, you know, and so what are some specific areas that we could kind of focus on if we have access to that, to where it will prepare us for the next one? So it just doesn't go, you know, everything goes in cycles, but if we can create it in an upward slope, especially for the infrastructure that we need, that's what I was trying to kind of, as I'm going through training, I'm sitting here thinking, okay, what are those areas that if we can use, if there's a silver lining to the pandemic, it is that we do get some more funding. And
Right.
What are the areas that we want to really beef up? Is it surveillance? Like one really big, I think, improvement is health accessibility, using and health education, using internet and using, you know, IT. And is that something that we can look at kind of building on and keeping going as part of our infrastructure in public health too?
Yeah, I mean, I'd be interested in what you think about that. Yeah, I agree. There are some basics that it seems like no matter what, we need to improve. You know, communications and how we communicate to the public, how we communicate challenging topics. We didn't see a great example from the top in this pandemic, and that was unfortunate. You know, but that's clearly an area. You know, I think communication, equity, and data/IT are always going to be key. What do you think?
You know what I always kind of try to look at the, you know, like if identifying and understanding the negatives of what we have. But one thing, for example, in some of the classes, when I look at rural health and I look at how there's been such a lack of ability for, you know, health services in rural areas, you know, I think this expansion of infrastructure that we now have that's been funded a lot more because of the pandemic, and also because of so many of the of the medical systems have turned to EMR and have also been able to use telehealth. That's not only improved healthcare delivery for the pandemic, but if we can sustain that, I think that will be something that will help us in rural areas, not just in the US, but across the whole, across the whole globe. So for example, when I was doing a surveillance class with Ebola, you know, one of the big problems that they have is having training healthcare workers in rural areas in order to do surveillance or to do education. And so now if we're able to use the infrastructure that we have and build on that, we can not only do address emergencies, but also work on the underlying health and prevention of illness. And that's where I was kind of looking, okay, so I have these ideas, but how do we go about actually bringing it into practice? And that was why, like what you were saying, really focusing on the practice of it and the practicality of it. So I see these possibilities, but how do you take it from a possibility into an actuality? And that's where I'm kind of in my training trying to figure that out. So
Right. And a lot of it is partnerships. I do think, you know, in public health, we don't do anything alone. We really don't. It really takes multiple people with different sorts of skills and perspectives, I think, to make something, especially something big like that happen. So it's about bringing the right people together to really make it happen. And the community is a really important part of that. You know, you can't make that happen if that's not what is going to really address the community's needs. So it, you know, the reason it's hard is because, or the reason it doesn't necessarily get done, because it's incredibly hard. It's not easy, right? I think it's really a challenge.
So I just had two comments. One was I really liked your idea of having such a key, what did you call it, a public health department, like
Academic public health department.
Yeah, I mean, I really think that's a great idea, and I'm actually kind of surprised that it doesn't already exist in a way that like the public health departments don't already have like positions or places that students fit in, you know, just generally, especially like even the largest one in the area. And then, and then the other question I have was more specific to what's going on right now with this which is you've been in this interim role, and they say you're a finalist. Are there other candidates as well, or are we just, you're going through just a formality of?
I don't know that I can answer that question. And I'm not sure that I want to put anyone else on the spot to try and answer that question. There's a process. You know, there's a application process. I don't know if I was the only candidate that applied, but I applied. And then part of that process is talking to both faculty and students and interviewing with a committee. So there's also a committee that I've interviewed with. So it's all part of a process. And I think it may seem like a formality, but it is I think an important process to actually hear from.
Oh no, I mean, I wasn't saying that. I just was wondering if there's some other candidates that we're supposed to be, you know, also listening to their thoughts as well. That's all I was.
Chloe is shaking her head.
I'm shaking my head. Not at this time. Dr. Miller is our finalist singular at this time.
Perfect. Good choice.
And I will pipe in that following this, we'll distribute the video and a survey so that students can provide their input into the process.
Dr. Miller, so I know, right, so this position sort of works between the school and the community and, you know, different organizations to, you know, work to sort of create those relationships and partnerships. So that said, you know, in the sort of COVID Zoom era, just in interacting with other students, I've been amazed by the amount of students that like aren't in Denver Metro or aren't in the Front Range, right? So with that, I would imagine that that's probably a fixture of the school moving forward, right? Just given the availability. So, I mean, how does that look, or how does that work with building relationships in the future? Do you see that the school is really just fostering relationships in, you know, Colorado, or is it expanding that network beyond that? Where do you see that going?
Well, I think, first of all, I think things will change. I don't think we'll be as separate as we have been for the past year forever. And I do think, you know, in the next 6 months, things will look quite differently. I think some aspects of that will remain, and some may be good for partnerships. So, you know, I think in the past when I thought, oh gosh, I'm going to have to get in the car and drive across the state to have a conversation with XYZ, and that's this hurdle that's difficult to get over. Now I think everybody is much more open to, let's jump on Zoom. You know, that's much better for everybody. It saves everybody time. It saves everybody money. It, you know, pollutes less. Let's talk to the Western Slope, or let's talk to our parent sort of umbrella schools of public health organization on Zoom. So I think in a way, the pandemic maybe assists us with those longer distance partnerships. And I do think the vision of the school is to have partnerships at all those levels, local, state, national, international. And it's not necessarily me. Again, this is a 0.2 FTE position. I see this position as really that umbrella. There are lots of those connections and partnerships that already exist. And I think it's just hard to catalog those right now, and we haven't done that. But, you know, we have our Center for Global Health. We have our Latino Policy Center. We have Cayenne with Native American and Alaskan Native relationships. You know, there are lots of centers and departments that have lots of relationships at all of those levels. So, you know, some of those are mine directly. I think a lot of those are just understanding what our existing partnerships are and promoting those and connecting, saying, oh yeah, so-and-so already has a connection there. No need to recreate that wheel. So, you know, I think that could be one of the things that comes out of this that is a little silver lining. Other questions? I don't want to keep people. I see Olivia on. Welcome, Olivia.
Yeah, I'm sorry I was late. Hi, Dr. Miller. Congratulations. I know you're still in the process, but go, Dr. Miller.
You might have mentioned, you might not have seen your shout out, but I did give you a shout out during the presentation.
Oh no, I'm sorry. I will watch the recording. I apologize.
I just mentioned the Student Response Initiative, so.
Lisa, Poppy has his hand raised.
Okay, great, Poppy.
Oh, thank you so much. So, based on your background and experience working with the government agency, also based on the partnership that Colorado School Public Health has with other public health agencies, do you think that as a associate dean, there is an opportunity to introduce a fellowship program for new graduates so they can have the opportunity to practice public health, since the practicum or capsule just lasts 120 hours? So this is my question.
Okay, let me, thanks, Poppy. Let me make sure I understand. So you're talking about an opportunity with state or local public health that's more of a fellowship, maybe more in depth and longer than a practicum? Is that what you're saying?
Yes. Yeah, this is what I'm thinking about. As I went to the CDC website, I see there's some kind of program where recent graduate can apply for a fellowship for like 2 years, just to practice public health, to be in the field, on the ground. So that's why I was thinking.
Yeah, and that CDC fellowship opportunity is a great opportunity. And I'd encourage, you know, all our students to look into that and to apply for that. And the advantage to public health departments with that CDC opportunity, I believe, is that CDC pays for it or pays a portion of that. So that's helpful. And I think that, you know, that's a great idea and something we should explore. And I mentioned we are exploring in the Department of Epi, are there other ways to give our students more experience? So we have practicum, we have the capstone, but, you know, for instance, like our PhD students have a field experience requirement. Can we do something more with that to give them more experience? And your idea of you know, a fellowship or some longer experience is another great idea. And I think those are all worth exploring. I think the challenge, especially now with COVID, is that public health departments are so strapped and so busy with the response that really trying to carve out that time to really mentor and guide students can be challenging. So that is something I think we need to work with our public health partners to figure out how do we make this more possible for them. And I will say
Thank you.
yeah, there are, I mentioned the case investigation contract tracing jobs at CDPHE. There's also other jobs. The State Health Department does hire students to do other kinds of work, like they did all the enteric disease investigations during COVID to free up CDPHE epidemiologists. So Elaine Scallon oversaw that effort to really, again, give our students that experience and help the public health agency as well. So it might work better if we can find ways to really find sort of permanent part-time jobs that achieve something the health departments need to achieve, but also give students experience and hopefully, some income. Well, if people don't have other questions, maybe we should wrap it up. And please do email me if you have other thoughts or input. Happy to take those. And I really appreciate your time and attention and especially this discussion. It's super fun to talk about this stuff. So thanks for coming and joining us. Bye all.
Yeah, thank you. Bye.
Bye, Poppy.